My name is Dr. Brobson Lutz. I'm a physician here in New Orleans. I practice internal medicine. Originally, I'm from North Alabama. I came down to Tulane to go to medical school and never left. Like many people who visit New Orleans, I fell in love with the city. It's my city now. I love New Orleans. I started practice in 1978. I started with Dr. Sam Hobson. He was 85 at the time and still making house calls. I still have about a dozen of the patients that I inherited from Dr. Hobson at the time, including 4 generations of some families. And I'm so thankful that I got to know Dr. Hobson and see how Dr. Hobson practiced. Dr. Hobson believed that everybody needed their own private internal medicine specialist. Dr. Hobson didn't believe in medicine by committee. Dr. Hobson didn't believe in a hospital team taking care of people. Dr. Hobson believed the patient was best taken care of by their own private doctor. And I believe that too. A patient I called Joe called about a year or so ago, and I've known Joe since I started practice. So a lot of things I give Joe, we treat on the telephone. That way you can save patients trips to the emergency room, urgent care, because a lot of the things that people go to these centers for now, you can treat on the phone if you know your patient. Well, Joe called. He says, my hemorrhoids are bleeding. What should I do for my hemorrhoids? And I said, well, you got to come in and let me look at that. Well, just tell me what to do for my hemorrhoids. I said, Joe, the path to hell is paved with hemorrhoids. Well, sure enough, Joe came in. I told him, look, you got to have a colonoscopy. We set up a colonoscopy, and he had a pre-malignant polyp that was removed. If I had just told him to go sit in a hot tub or something, that polyp wouldn't have been detected. So you've got to think of the other possibilities that surround a certain presentation. On the other hand, a medical student, I'll call Frank, he was a medical student at the time, called me one morning. He says, Dr. Lutz, I think I have colon cancer. I just passed all this blood. And but people 22 years old don't typically have colon cancer. So I said, Frank, where'd you eat last night? Oh, I ate at Peristyle, great restaurant in town. I knew Frank's habits. I said, did you eat beets? He said, yeah, I ate beets. And he says, well, don't worry about it. It'll go away. And sure enough, if at a certain age you eat a certain amount of beets, you're going to see red-colored toilet water. And it's nice to be able to reassure people based on their age and knowing their habits, knowing what they do, knowing a lot about them. If either of those patients had called me out of the blue, I couldn't have done that. But I knew my patients, and that's what I think is important. It's important for patients to have a doctor who knows them and vice versa. Most of my long-term patients know my idiosyncrasies. Number one is if they come in, I want them to bring their prescription bottles. That does a couple of things. Number one, that imprints to me what they're taking. If I see the patient with the medication bottle, it makes an imprint for me. Number two, a lot of patients are on too many medications. Polypharmacy is a huge problem, especially in the older population today. And there's always the opportunity to trim back on the number of medications a patient's taking. I had a woman, I'll call her Ada, about 68 or so. Her blood pressure, I can never control her blood pressure. Her blood pressure's always high. I add drugs, I double doses, blood pressure's always high. But I could never get Ada to bring in her prescription bottles. Oh, I left them at home. Best way to know is to bring in the bottles. And so Ada finally brought in her bottles, and it turned out that she was coming to see me every 3 or 4 weeks, but she was never taking her medications like she was supposed to. Then all of a sudden, she would start taking them all at once, and they were too much for her because I had increased dosages, not knowing that she was actually not taking anything. So once I got Ada to start bringing in all her prescription bottles, we got her blood pressure adjusted in less than 6 weeks. That was a success story for me and for Ada. There are multiple problems facing healthcare today. Many of these stem from the insurance companies and how insurance companies have reimbursed hospitals and physicians through the years. Some of the most important services are those that the physician does with the most important tool he has, the most important computer that he has. That's the one right up here. Insurance companies don't like paying for doctors to think and ask questions. Insurance companies like paying for surgical procedures or things that are complicated. And that's not what medicine is all about. I can diagnose most problems in my patients just by talking to them, by taking a good history. But the reimbursement through the insurance companies today makes that very difficult for a physician to have the time to sit down and really get at what's wrong with a patient from talking to them. The insurance companies have gotten physicians in this mode where it's easier to order a test than to talk to a patient. That's not right. One disease process rarely explains all the symptoms that a patient has. It takes time to sort out these symptoms. You need to have a good bedside manner. You've got to have the time to spend with the patient, to find out what's going on, and to get the ins and outs of the various symptoms. If somebody comes in and has a headache, that's not enough. You need to know, have they ever had this kind of headache before? How long does the headache last? Is there anything that makes it better? Does it occur daily, every other day, or is it constant? These are things that take time. There's no magic test for a headache. Sure, somebody comes in, they says, I've got a headache, I want an MRI. You order an MRI. Very rarely does that result in any favorable outcome. To me, personalized medicine is a new practice model that has only been around New Orleans a couple of years as far as I can determine, but I'm really impressed by it. My physician friends who have changed their practice to a membership medicine type practice, they're happier. Their patients are happier. They have less hassles. They're taking care of fewer patients, so they can devote more time to patients. Patients can get usually same-day appointments. Patients can get the attention that they need and that they deserve. Somebody who's in good health and may only see a doctor a couple of times a year, I think this kind of model has a lot of advantages for them. Number one, it arranges for a very comprehensive annual physical exam over and beyond what any insurance company would pay for. Number two, you're always available. So instead of going to an urgent care or an emergency room for a sore throat or a cough, a phone call to me gets you a prescription and some advice. You can do that if you're living on Britannia Street, if you're living on Louisa Street, or if you're vacationing in London. You can call me. I'll tell you what I think about it. I'll tell you what I think you ought to do. I maintain current hospital privileges both at Touro Infirmary and Ochsner Baptist Medical Center. Each has its pluses and its minuses, but if my patients are hospitalized there, I intend to be checking up on them to see how they're doing. I'm not going to leave them total to the mercy of the hospitalists or the physician's assistants or nurse assistants or whoever the hospital has hired taking care of hospitalized patients. I tell my patients that specialty care is complicated. Specialty care is when you need a specialist, you want somebody on your primary care physician's team. Your primary care physician knows the specialists that do the best job, whether it's somebody here in New Orleans or whether it's sending somebody to MD Anderson or whatever. A good primary care physician knows where the good specialists are. I like suggesting specialists to my patients. I refer them to people on my team. I oftentimes have patients that end up with specialists that I don't know. To me, that's like putting together an NFL football team that has a player from each team from all over on it. I mean, they've never trained together, they've never practiced together, they don't communicate. It's a mess. You want to use specialists that your primary care physician refers you to, ones that he trusts, ones that are going to give you the best possible outcome. The treatment you get depends on the doctor you have. No doubt about it.